I'm Dr. Julie Dobbs from Animal-Oasis-of-the-Rockies, and today I would like to help you better understand cat anesthesia and why we may use anesthesia on your cat. My assistant Heaven will be helping out by asking some questions, and I hope you're able to better understand more about the role of anesthesia in feline veterinary care.
Dr. Julie, what is anesthesia?
Yeah, so anesthesia is really, we're getting them to a plane of consciousness and in their body that they're not conscious of what's happening, and their body isn't able to feel as much pain. So really, we're getting them to an unconscious state using a variety of drugs and inhalant gas.
And why would a cat need anesthesia?
Yeah, so I'll start from the beginning of life, getting your cat spayed. That is something that we do under full anesthesia. And then probably later in life, the most common reason for cats to be under anesthesia is for dental procedures. Otherwise, you're looking at any reason why we may need to intervene medically to fix something. So like a broken bone, mass removal, things like that.
And how do I know anesthesia is safe for my cat?
Yeah, so if heart and lungs sound good and if blood work looks good on your cat, then their risk for anesthesia is very, very low. So even if they're an older cat, I say age is not a disease. As long as blood work looks good and heart and lungs sound good, the risk for anesthesia is really low.
And what's the difference between anesthesia and sedation?
That is a great question. So I was taught in vet school, this diagram comes to mind where it's more of there's sedation on one end and then all the way over here is anesthesia. So it's actually more of a gray area. So generally when we talk about anesthesia, that means that they have a breathing tube in, and so they're breathing in oxygen and anesthetic gas. However, in order to get them to that state, we do have to give them a series of injections that are sedatives. So that first thing is that they're nice and calm when we place an IV catheter, so a tube directly into the vein. We actually give them more medications through that IV catheter, get them to a place where we can actually place that breathing tube.
And what do I need to know before my cat goes for an anesthetic procedure? Is there pre-exam required, blood work, or any fasting?
Yeah, so we always do want to do an exam ahead of time, make sure that there's not any huge red flags like a heart murmur, abnormal heart rate, lungs sound good, pulses feel good, things like that. And then we also repeat that examination the morning of their anesthetic event, make sure that no major changes happened. Then we also want to do blood work that is overall required. There are some special cases where an animal is a little bit too spicy, especially when it comes to cats, that we can't safely get blood work before we get them sedated. But if that's the case, we give them some sedatives, then we draw blood, and then we move forward with anesthesia once we have the blood work back. And then fasting. Fasting is not necessarily required, but it makes the anesthesia a lot safer, because the reason that we ask for their stomach to be empty is that we don't want them vomiting or regurgitating and inhaling any of that stomach content while they're under. That can cause things like pneumonia. So fasting, definitely a want, but like let's say it's an emergency procedure and they already had breakfast, then so be it. We just move forward.
What are some possible complications of anesthesia my cat could experience?
Yeah, so the most common issues that we see in cats is getting cold under anesthesia. So we always have a lot of warm blankets, heating mats, things like that during anesthesia and afterwards. That's probably the most common complication. The second most common complication, I would say, is a low blood pressure. But we do lots of intervention to help get it to a point where it's not dangerously low. So more fluids, reduce the anesthetic gas rate that they're inhaling, and that can definitely help with blood pressure. Other things too that are not foreseen would be like an abnormal electrical activity of the heart. So the ECG might look abnormal. And very, very rarely do we have really serious complications like where their heart rate stops and death. But we do everything we can to avoid that. And generally, again, if their blood work looks good and heart and lungs sound good, risk for anesthesia is extremely low.
What will the veterinarian do to ensure my cat is safe while undergoing anesthesia?
Yeah, so I did touch on that a little bit. So again, making sure that we're not seeing any big red flags before the procedure, and then during the procedure, we have all the bells and whistles needed for monitoring. So we're looking at heart rate, electrical activity of the heart with an ECG, looking at blood pressure, checking oxygen saturation levels, checking breathing rate, everything like that. And if there are any abnormalities in those, there are a lot of interventions we can do before it becomes something that's dangerous. So again, medications to help increase heart rate or regulate heart rate. We can do we can also give them fluids to help boost their blood pressure. We can reduce the amount of anesthetic gas we're using. So yeah, definitely a lot of interventions.
Okay, and last question. What type of care should I provide as my cat is coming out of anesthesia?
Yeah, so hopefully we will be the ones helping your cat out of anesthesia, and they leave the hospital, maybe just a little bit groggy. However, sometimes cats can get a little bit excited on certain medications, like especially opiates, which is our go-to pain medication for cats. So you might see them have like erect whiskers, dilated pupils, making excessive muffins, get the zoomies. So if that's the case, just keep them in a nice, dark, confined place so that they can't run around and hurt themselves. Yeah. And then if you have any questions regarding cat anesthesia, please give us a call. We're here to help.